gave me foundations as to how to be a member of a really important interdisciplinary team. And working alongside allied professionals, whether it's behavioral health to nurse practitioners, to our additional allied staff. It's how do you work well together as a team, and sort of first experience is really doing that well, and being able to continue to do that effectively in my current work today is really centered around a lot of the foundation learnings that I had at COE.
We're so excited to bring what we've learned here over the past year forward throughout our careers.
And the COE mission overall to create this team environment really encompasses what healthcare should truly be today.
One of my fondest memories were really just the time that we were allocated to spend with different health professional trainees from different professions, are really learning both not only their background and who they were as individuals, but how we can work together and what are the different skill sets that each of us can bring to the table to really advance the care for patients and veterans.
And what I really liked about the COE was just how much of a one-stop shop it was for patients. So I would routinely see patients coming in for back pain, knee pain, and not only were they seeing me, but they were also seeing a physical therapist in the same visit. And instead of having to wait many, many weeks to see a physical therapist, they were able to right then and there on the spot get recommendations for exercises from the physical therapist.
Well, I really think that this year has shown me what a fully integrated primary care setting looks like. So I'm much more comfortable and adept at doing curbside consultation and Skype consultation and follow-up with pharmacy and medicine and nursing after this year of training.
Learning in that environment and getting to practice in that environment taught me not only how to be an excellent critical thinker and primary care clinician, but also how to be a leader in my field and how to improve quality, how to improve systems of care. Healthcare is a team sport, as we all know, and I think the COE teaches us just how much care improves when we work on a truly integrated interprofessional team with everyone at the table together.
I feel confident collaborating with my attending and confident in the decisions I make and why I make them, and explaining myself and reaching out to specialists to coordinate care and involving interdisciplinary specialties, and I see that benefit my patients as well. And I have the COE to thank for that.
I'm currently the Vice President of Ambulatory Care at New York City Health and Hospitals, the largest public healthcare system in the country. Not only am I moving us towards an interprofessional collaboration model based on my experience with the VA, but we're even starting our first nurse practitioner residency program here, modeled after my experience at the VA Center of Excellence, which I would only be able to do based on my fervent belief that this is the right way to deliver high quality care. This is the right way for physicians, nurse practitioners, and other professionals to train together.
Thinking about what's the future of NPs within this new way of delivering care, and what are the essential skill sets to be able to provide that care. I really want to have been able to do that without COE, and really thinking about how is it that we can combine our forces and our knowledge to really create a better health system that's more convenient.
Training in the COE was the single most important element of my clinical development during residency. It was the perfect setting where I could pursue my interests in both primary care and geriatrics. The most formative example of that for me was in the improved polypharmacy clinic, sitting around the conference table with the different health professionals and the COE trainees and discussing patient cases in preparation for the polypharmacy clinic. I learned a great deal from that clinic, not just about medication management for older adults, but also how to engage in shared decision making, carefully gauging the potential benefits and trade-offs of any medication changes we might make.
Because of the immersion block structure and because of all the supports and resources around me, I've been able to make real progress with regard to my professional capacity in shared decision making and learning some of the highest evidence from our shared decision making curriculum. That being said, I feel like most of the decisions I'm making with patients involve that collaboration, and so it's all of these resources that have been placed around us that's allowed that to happen.
We focus on, kind of a full primary care approach to the patient, doing shared decision making courses, motivational interviewing, which I think is very valuable. I even used the shared decision making I learned in the COE as I've gone into other rotations, such as the emergency room, which was very useful.
One of my first experiences at the COE was collaborating with our health psychologist and a nurse practitioner resident on a project to discuss this innovative approach for how to address addiction in primary care. We submitted it to the state competition. We ended up winning, and that project helped inspire me to go on to train as an addiction medicine fellow.
It stands to say that without the COE's presence in my life, I would undoubtedly probably not have become a primary care physician. As a physician, the opportunity to practice meaningfully in the outpatient setting, to get incredible exposure to the depth and breadth of what an interprofessional team can do, and what incredible care can emerge and systems change can occur when you have real trust at the formation of interprofessional relationship, was absolutely foundational in my decision to become a primary care physician, and which I've stayed through now 6 years after graduation and hopefully for the rest of my life.
I value interprofessional care so much. My experience with working with veterans is the whole reason why I refuse to leave a VA or go anywhere without a VA.
I currently work in a family medicine residency program, and I work as a faculty helping support psychosocial learning. And I loved the postdoc that I did so much in integrated care and advanced primary care that I actually am now the director of a brand new fellowship here at my institution, where I'm co-training psychology doctorate postdocs who are working with medical residents and learning many of the same wonderful skills on how to be a psychologist in integrated primary care. So I'm forever grateful to the COE for not only influencing my, training, but my career path and my life.
COE has become my community, my family. Our original class, Ted Long, Chris Shayashadi, Trisha Siddharthan, Alan Sparoff, Susan Behringer, and others, are trainees thereafter, Amish Desai, who I work with now at Oak Street Health. That is the community that I carry, right, with me from Yale, from the West Haven VA, and from all sorts of places. And it is really our tribe that is carrying healthcare in such an incredibly forward progressing sort of way.
I have just now, this afternoon, finished my last clinic here at the West Haven VA. And I have to say that the numbers, or the experience of caring for individuals for the last 3 years and now signing off has been quite emotional for both myself and my patients. I know their families, I know their fears, I know their medical histories backwards and forwards, and we've been able to make quite a bit of progress.
It's really a privilege to be here at the COE and kind of work with these great mentors, and I know it's going to affect my practice greatly in the future.
Congratulations. Thank you.
So, thanks, COE.
Just can't thank everyone who's been involved in this amazing organization enough.
Thank you so much.
Say thank you to Rebecca Brienza and the VA Center of Excellence in Primary Care Education.
Well, thanks so much for everything that the COE has done.
Thanks, COE.